Hi, I'm Scott Leadingham. Thanks for joining us here in the unique Northwest. Lots of news out there, not just on the coronavirus front, not just on the protests for racial justice. There's much more out there. We're going to talk a little bit about that and some coronavirus news. And joining us to talk about it is Enrique Perez de la Rosa in Yakima. Thanks for joining us today, Enrique.
Thanks for having me.
So on the non-coronavirus front, Enrique, a lawsuit recently filed against Yakima County dealing with how the county conducts its elections. And there's a little bit of deja vu in there. We'll get to that. So tell us, though, what is this lawsuit against Yakima County all about?
So this lawsuit was just filed on July 13th by 4 residents. We've known about this since January when One America, an immigrant advocacy organization based in Seattle, warned Yakima County that its electoral system was unfairly diluting Latino votes. The reason they argue this is because to get elected in Yakima County, candidates have to go through a primary in their district, and then the top 2 candidates from each district face off in county-wide elections. Yakima County has a slight white majority county-wide. That means in Latino majority districts, the candidates that those communities back might not make it in the general election. Plaintiffs also say they're suing because Yakima County hasn't taken any action since being warned about this issue in January, but County Prosecutor Joseph Brusick says that that's not true, that the county has been looking into these claims, but that's been delayed by their work responding to the COVID-19 pandemic.
The city of Yakima, not the county, city of Yakima went through a very similar thing, a lawsuit, federal court case 8 years ago, and it was resolved a few years later. Remind us what happened with the city of Yakima and the claims against it.
Almost the same thing happened. Honestly, the plaintiffs made pretty similar arguments that voters in the city of Yakima voted along racial lines and that the slight white majority in citywide elections in November suppressed candidates that were backed in Latino districts in the August primary. And actually, in the end, federal courts sided with plaintiffs and they forced the city to redraw its districts and just do everything by district. And that's actually where these 2 cases might vary, because in this 2020 case, they're proposing that the electoral system be replaced with the ranked choice voting system, which would get rid of primaries entirely and instead replace that with the ability for voters to rank their candidates and then redistribute votes from losing candidates to other candidates.
To summarize some of the reaction, frankly, that we've seen on this story from the previous time when it involved the city and again now with the county, it sort of goes like this. Well, why does it matter the race or the ethnicity of a particular candidate or member of the county commission or city council, as long as they do a good job and they're there to represent all people equally? And so on the other side of that, I wonder what the advocacy groups and the voters themselves who are Latinx, what they say to that. Like, why do they say it's important to have Latinx candidates represented on this county commission and the city council?
The argument for racial representation in the city council and the county commission goes beyond just having a certain ethnicity at the table. It's more about what that person brings in terms of their lived experiences. And sometimes that depends a lot on someone's race or their ethnic background. And, even outside of race and ethnicity, that lived experience is something that's seen as valuable when we talk about officials who have experience, for example, in the business community. And here in Yakima County, a good example of that is Commissioner Vicki Baker, who has been very vocal for the small business interests during the pandemic. Maybe that's because she owns a grocery store and knows what small businesses are experiencing. So the same argument applies to racial and ethnic representation, is that someone who comes from those communities and has lived as someone Latino, they know what that community is potentially going through or have more insight, not just during a pandemic, but every day.
Finally, on the other front that Yakima is known for recently, on the coronavirus front, lest we forget that is a major issue in that part of the state and, of course, all over the region. But Yakima County, of course, has been one of the hardest hit in Washington and on a per capita case basis across the whole country, frankly. So Some mask mandate, of course, went into effect in Yakima County. Governor Inslee imposed that and then eventually extended that statewide shortly thereafter. Just from your view on the ground, how are things been going on that front in Yakima County?
Personally, I've seen a lot more people wearing masks. And now the health district is saying that 95% of people are wearing masks. And that's a huge amount of progress from back in May when it was just about a third of people. After that, the health district issued their mandate and that went up to 60. And then now it seems that the governor's order making wearing a mask mandatory to go into businesses, that has really shot it up to 95. There's preliminary evidence that it is working to bend down that curve in our case rate growth.
Indeed. Well, thank you for sharing that information. We'll be sure to check in as we go along in this pandemic. Enrique, thank you so much for joining us today.
Thanks for having me.
And we turn now to correspondent Tom Bonsi in Olympia. Thanks for joining us, Tom.
Pleasure to be with you.
Some new information is out about the number of deaths attributed to coronavirus, and you've been looking into that. Generally speaking, in our neck of the woods, particularly Oregon and Washington, what are those numbers saying?
Well, I looked into the concern that maybe the official case count and death toll isn't fully capturing the extent of the pandemic. And the way medical professionals look into this is something called excess deaths. So they looked for, and we asked for the data on deaths from all causes, not just COVID-19, since the pandemic started. And it's kind of interesting. There is definitely a surge of deaths other than COVID that kind of track with that peak that we had in late March, April, early May from COVID deaths, from people dying from other things. And the question is that collateral damage, or maybe there were a lot of uncounted or missed COVID cases?
And it's known that COVID-19 adversely affects populations who are older, 65 and above, more heavily, people with underlying health conditions, of course. And in these excess deaths that are so far unattributed officially to COVID-19, is that the same case? Is it also affecting people of that advanced age?
Could well be. There's a high suspicion that some or most of these are unrecognized COVID cases. I mean, a lot of them came in the long-term care homes, nursing homes, where COVID just was on fire periodically this spring. The Centers for Disease Control has the analysis of the death certificates, and we looked at that for Washington and Oregon, and there's a noticeable representation of Alzheimer's and dementia cases there as cause of death, strokes, diabetes, heart disease, things that, in many cases, the person would be fragile to begin with, and then along comes the disruption of the pandemic, and their family can't visit them anymore. They're isolated in their rooms with maybe just visits to have food delivered all day long. So there's loneliness and now abandonment. All of them might send somebody spiraling down faster. The death certificate might not say COVID on it, but it's probably related.
I wonder if now sort of these excess deaths, as we've talked about them, are now able to be caught, perhaps because we know so much about what to look out for, and that might not be the case going forward into the summer and fall.
Yes, absolutely. The epidemiologists are definitely on the watch for this. The death rate has gone down, and with it, overall deaths now appear to be in the normal range again for all three of our Northwest states. We should add that when you get into the recent weeks, the deaths data is really pretty preliminary. Now, it takes a while for death certificates sometimes to be processed and cataloged. So it's a little hard to say what's happening in June and here in the first half of July, but it does look like we're in better shape. The increased amount of testing may be a big part of that.
Well, I wanted to ask about the increased amount of testing. That's sort of been talked about for a long time as not necessarily a panacea, a cure-all for everything, but something that was greatly needed throughout the entire country. And now that testing capacity, in theory, has increased, has that ability, particularly in like long-term care facilities, sort of given health officials the ability to catch these sorts of things very early on and solve them before they turn into deaths. So is it solely attributed to increased testing capacity, or are there other factors at play?
Certainly testing is better. I heard, just this week from this National Nursing Home Group, as well as from the Alzheimer's Association, that testing still needs to improve further. There's some frustration that, say, professional athletes that are now getting back into action can get tested every other day. And yet we've just completed a few weeks ago the first statewide sweep through testing all staff and residents in nursing homes in Washington State. So there's more to do for sure yet.
There is, and we will certainly look forward to hearing from you about it when you are there to report on it. Thanks for joining us today, Tom.
You're welcome.
You can see more on these and other stories and more coronavirus updates and resources at our website, nwpb.org. Thank you for joining us here in the unique Northwest.